Good morning, everyone, and especially to the viewers on our YouTube channel. Good morning on this wet Jamaican morning. I welcome all of you to the Way to Normalcy, a COVID conversation with tertiary students. I am Marvadeen Singh-Wilmot, and I am the Associate Dean for Student Experience in the Faculty of Science and Technology at the University of the West Indies, Mona campus. We call ourselves the FST. This event is organized by the FST in association with the Faculty of Science and Sport at the University of Technology, the Faculty of Science and Technology at the Micah University College, the College of Natural and Applied Sciences at Northern Caribbean University, the Edna Manley College of the Visual and Performing Arts, and the Shortwood Teachers College. Now, a number of COVID conversations have been happening across the country with various institutions doing their part. In fact, last night, many of you would have watched the TVJ hosted town hall COVID conversation. And so people are getting their questions answered. However, this is the first conversation specially designed for you, Jamaican university and college, and in fact, all tertiary students in Jamaica. And it is even more special because it is being hosted by you too. All your student presidents will take the stage this morning. They will represent you, and they will give you that safe space to express your fears and even your excitement about the COVID vaccine. I know many of you, like us, are longing to be back on your campuses, to feel the campus vibe in your bones again. You know, we all have the same mission, but we just need some help in getting there. So before I hand over to your presidents, allow me to introduce to you the expert team who will this morning be helping us to get there. We welcome Dr. Jacquiline Bisasor McKenzie. We all know and love her for the outstanding service that she has been giving to our country, particularly during this pandemic. As Jamaica's Chief Medical Officer, we know her as our CMO. We have Dr. Sandra Jackson, who is a clinical virologist in the Department of Microbiology at the UWI. And Dr. Sandra Lindsay, everybody. She is joining us from New York. She's a Jamaican-born critical care nurse who led her team in the fight against COVID during the spike in New York. She was at the epicenter. This was some months ago, and she's also the first American to have been vaccinated. So Sandra is sharing with us this morning. Once again, I want to welcome all our guest panelists and to the team of student leaders who are here and all of you who are watching on YouTube. I send a warm welcome. We look forward to an impactful engagement. I now hand over to Ms. Danielle Mullings, who will introduce the student presidents.
Good morning, everyone. It's a pleasure to be speaking with tertiary students as always and engaging young people on important and salient topics such as these that are affecting us right now. Thank you for joining us on the Way to Normalcy, a COVID conversation with tertiary students. Now, student leadership takes various forms. It means having difficult conversations and creating those spaces for us to address, our fears, our concerns, or even our excitement with respect to salient issues that are affecting us now. So let us arm our students with the science and knowledge that they need to make informed and responsible decisions in the fight against COVID-19. Let's combat conspiracy theories surrounding vaccines and viruses, and let's do it as our part to show Jamaica and the world the way to normalcy. That being said, it is my pleasure to introduce the student presidents, or student body presidents rather, from various institutions that will be joining us here today. Firstly, we have Ms. Wiggan. She's a Students' Council President for the Edna Manley College of the Visual and Performing Arts. We have Mr. Neil Brevet. He's the president of the United Student Movement at NCU. We also have Mr. Chavoy Lyons. He's the guild president at the Micah University College. And we have Mr. Micah Brown, Director of Health and Safety at the UTEC Students Union Council. Additionally, we have Ramon Smith, the college president of Shortwood Teachers College, Student Executive. And of course, we have myself, and my name is Danielle Mullings, and I'm Guild President for the University of the West Indies, Mona Campus. We also want to take this opportunity to extend a special welcome to all students that are tuned in from all the various campuses. We're excited to have these conversations and engage you on this issue. That being said, we've orchestrated this event to be a series of conversations. The same way, you might go on the road and have a conversation one-on-one with this or that person. We're having the same conversations here with the experts who can give us the answers that we so desire. That being said, the first COVID conversation will be on the state of Jamaica and COVID-19. The moderators will be Ms. Kai Wiggins from Edna Manley and Mr. Micah Brown from UTech Students Union. They'll be speaking with our Chief Medical Officer, Dr. Jacquiline Bisasor McKenzie. So over to you, Kai and Micah, as well as Dr. Jacquiline Bisasor McKenzie.
Okay, good day, everyone. It's a pleasure to be here speaking to you guys about everything once again. It's very important that we all are very much aware of what's happening in our country, especially as it relates to COVID-19. So we have a few questions. The first question would be, could you speak to us briefly about the COVID situation in Jamaica in terms of our bed occupancy as well as the percentage of locally transmitted cases within our country holistically?
Is that question directed at me?
Yes, it is.
Okay, all right, thank you. And morning, everyone. It's my pleasure to join you. I had to rush out of another meeting to join you, but I did promise, and so I am here. You have been seeing the updates, and just to give you a quick run through. I think yesterday we would have confirmed over 400 cases yesterday, and that would have brought our overall figures to over 64,000 in terms of the overall numbers that have been confirmed positive since the start of our first record of case on March the 10th last year. We would have seen in the update, if you follow on the web, that almost all of our parishes are affected. We're seeing cases right across the parishes, and up to between 50 to 75% of our communities I know of as of last week, haven't seen for this week as yet, were affected right across the country. We would be recognizing that we're still having the highest rates of occurrence among the 20 to 29 age group, as well as the 30 to 39 age group. And that suggests that there is a lot more exposure and a lot more spread that is happening in that age group. And I know that many persons in their university years would fall into this age group. And so it is even more important for us to have this conversation to say how it is that we decrease your risk and decrease the risk that you present to others, especially the more vulnerable persons that are in your homes. Because despite the fact that we're seeing that the largest numbers of positives are in this age group, then we would have seen that the largest number of deaths would still be in the over 60 age group. And this suggests that there are many persons, I mean, we have over 80s, over 90s, over 100 that are being affected. And these people are not as ambulant and moving around. And it does suggest that there is some bringing in of the virus to these persons, exposing them and leading to them having a severe illness. For this present spike, what we would notice again, compared to the second wave, which we had in March, April last year, was that there is a definite increase in the 18 to 39 age group in terms of the number of cases. 43% of cases are within that age group compared to 37% in the second wave. So it is increasing the spread in this age group. What we would have seen as well is that in terms of deaths, that we are seeing an increase in the number of deaths in the 40 to 59 age group, as quite a number of our over 60s have been vaccinated, not nearly where we want it to be, but we would have seen a decrease in the proportionate number of deaths in that age group compared to the last surge, where we're seeing 64% of deaths are in that age group now, compared to 76% in the second wave. But what we're seeing now is that there is an increase in the 40 to 59 age group, where that the number of deaths now are almost 30% compared to just under 20% in the second wave. In terms of our admissions to hospital, we would have seen a steady, since July, the beginning of July, we would have, or probably about the middle of July, we would have seen a steady increase in the number of persons that are admitted on a daily basis. And that would have gone up from approximately 20, an average of 20 per day, to now we have over 100 per day of persons admitted to hospitals for COVID. And these are both suspected and confirmed cases. And once we get to over 100, it really puts us in a big problem, because the length of stay in hospital averages between 7 to 14 days, sometimes longer, sometimes shorter, but on average 7 to 14 days. And what it means is that for a week, you could have 700 admissions, and for 2 weeks, 1,400 admissions, which means that our bed capacity in terms of management of these patients, we would have gone way over. Last week, we would have pointed out that if we continued on this trend, by the middle of this week, we would have been over 1,000 beds occupied, compared to the 700 beds that we have prepared for management of COVID. And what this means now is that with over 1,000 beds occupied, because that has happened, it means that we are taking over the general wards. Many hospitals now have to convert some of their general wards to COVID management. And this does put a bit of stress on the hospitals. We just have sent out the notice to the hospitals that they should go on emergencies only, because now we have to conserve on items such as oxygen, because elective surgeries, for example, will take up the use of oxygen, one in the delivery of the surgery, and then two in the management of the patient after. And so we have cut down on those cases in our hospitals. We have resorted to emergency admissions only, discharging the patients that we think can be managed at home, and arranging other methods of follow-up for these patients. We have also put out that we do encourage persons to manage their chronic diseases as best as they can, take their medication, stick to the management plan that they have, because this is not the time for us to go into any kind of acute event, because the ability to manage in our emergency rooms has been compromised. As well, the same for traffic being on the road, because traffic accidents as well do take up a lot of resources that we have little to spend at this time. And so we're asking persons to be careful on the roads as well, because we want to decrease your likelihood of visiting the emergency department. So just to say that, across all the parishes, most of the parishes now, we are seeing that the third wave is looking worse than the second wave. And right now, our numbers are still going up. We're still on the upward side of the curve. We have not peaked as yet, we would not have, we can't say that we have reached a plateau as yet. So the numbers are really from day to day, they are going up. And we are also seeing that there's an increase in the number of deaths. Each day you would have recognized the reports. I think we reported 22 deaths yesterday, 17 the day before, 15 the day before, 13 the day before. And these are high numbers compared to where we were before, when for a long period, we were averaging 3 to 4 deaths per day. No death is acceptable, but our figures were down to that, and now we're going up to as high as 22 reported yesterday. So essentially, what is it that we have to prevent this from going further, to try to get this under control? We recognize that where we have inserted restrictions, that they have worked in the past, and we continue to implore persons, to abide by the restrictions that have been put in place. And really and truly, what the restrictions are about is to decrease movement and decrease your likelihood of exposure. In terms of the personal protective measures, in terms of the wearing of the mask, hand sanitizing, maintaining your physical distance, these are still important today as they were, early on in the pandemic. These are measures that will work to decrease your risk of exposure. And we cannot emphasize more how important these are. Vaccination is what we have as the method that we have seen work. In different countries, we would have seen that with vaccination, there is a decrease in the number of hospitalizations. There are a lot of things.
Excuse me. I want to interject for a second because we only have 15 minutes, and I want to ask you another question before you go on.
Sure.
So there are some questions in the chat that I'm going to read out. So here's one. ATA means that Jamaica is already near herd immunity for our country. That means that natural immunity brings wider coverage of not only antibody but T cells. So I wanted to talk about that. So if we have more persons vaccinated, like what effect will that bring to the entire country?
Can you you said a lot of things in that question a while ago. Just go, I will see if I see it in the chat.
At the top.
This is the one at nearly 50%?
Yeah, that one.
At nearly 50%.
Oh, no, the one above it,
Okay, at mean that Jamaica is already near herd immunity for our country. Natural immunity brings wider coverage, not only antibodies but T cells. We know that, and our virologist is on, who may be able to expound better on this. But the level of antibody production, the length of that immunity for COVID, what we're seeing is that there is not a long-lasting immunity that is there. We're seeing that persons who have natural immunity, the immunity will last up to 3 to 6 months. And we have seen reports that persons have been saying up to a year. But then it is not predictable either that to say that everybody who gets COVID will in fact trigger all the types of immunity response that will result in them having any kind of memory of the virus. Not everybody you can predict that their response is going to be adequate, that they will be able to mount a good response later on. So for us to depend solely on natural immunity to provide herd immunity, it would be at a tremendous expense to us in terms of the number of hospitalizations and deaths that can occur if it is that you try to go that way. And especially, when you know that after a certain time, you're going to see increasing more reinfections with new strains coming about, the possibility of new infections, with a different strain. So I don't think we can rely on that. It would not be safe. It would come at a tremendous cost to life and to the impact on the health system.
So CMO, I just want to interject really quickly, because I know that the person that asked this probably has a background in, science or, some corresponding biology or but for those who don't know what natural immunity is, I think it's important to clearly distinguish between natural immunity and vaccination, just so that persons watching don't get confused with those two.
Okay, well, in terms of, your body's ability to fight infection, I think, as I said, Dr. Jackson may be able to better explain this. And I don't know if she wants to go right ahead. I just say one line to say that, your first line of response is your innate immunity, where your cells respond by attacking the receptors within your cells, attack the virus, and then you will have some kind of cellular response later on, which can result in antibody production, or another type of cell that is able to also fight, which are the T cells that are also able to fight the infection. So you have different levels of response that can occur, and you may not get to the point where all the levels of response are activated, but they will all provide some response. And if you get to the point where you have your cellular response and there is some memory of the infection that is there, which is different now from so the other type of immunity, acquired immunity, when you give persons antibodies to provide, you give them the vaccine that will trigger an antibody response, then there is some memory of the infection, so that when your body is exposed the next time, it can mount a response quickly. I don't know if I've confused everybody there. Dr. Jackson.
Yes, Dr. Bisasor, that you did very well. Yeah.
Okay, I have another one.
I want to ask a question.
Oh, you do? Okay.
Yeah. In relation to the situation in Jamaica, of course, are we doing a fair job in trying to keep down COVID cases, as well as do you think our lockdowns are effective, and if so, why?
Well, we have shown the data that have shown, because remember that what lockdowns are restrictions to prevent movement. That's what it is. The fact is that if you, and I'm going to use this example, if you go to a party and you are exposed, then for those persons who will develop infection, they can develop that infection between 0 to 14 days. That's the most 99% of persons. There are going to be some that are going to be over, but the majority of persons are going to develop infection between 0 to 14 days. If those persons actually stayed home for that 0 to 14 days and decreased their interaction with other persons, then yes, they may become infected and they may get over the infection over time, but they do not spread it if they stay at home, versus now if these were 50 persons who attended this party and say 25 of them developed symptoms, but they're out there interacting, they went to another party after and they spread to other people, then the likelihood of spread, and this is how the reproductive rate in the country increases, because one person is now spreading to 3-4 other persons, and these 3-4 other persons continue to spread it. So that is why we have restrictions to decrease movement and decrease your likelihood of spreading it, because the fact of the matter is that the infection prevention control measures are excellent in decreasing the ability to spread, but not everybody is able to abide by these measures. And sometimes really and truly situations are difficult that make you abide by them. So you have to use a combination of measures where it is that you use those precautions, but you also decrease your interaction through the, and this is it, if persons would put themselves on curfew and restrict themselves, then there would be no need for national restrictions. And, I applaud the Jamaican people because I do believe that there has been some amount of personal responsibility. A lot of people have been very, very responsible, but what we are seeing is that a lot more people are not. And we see persons on the road, we see the pictures of the gatherings, etc. That's exposure. Right now with the positivity rate, if you go out and interact with a crowd, you more than likely somebody in that crowd is COVID positive, more than likely, and more than likely you would have been exposed. So we really need to cut our chances of exposure at this time. And yes, it has been found to be effective.
Okay, thank you. I have another question. So wait, let me go up. All right. How long after a person has recovered from the virus can she or he be safely vaccinated?
Okay. All right. A lot of I've seen so much debate about this, and I'm going to tell you what the advice is from the WHO. First of all, nobody who is sick, who have symptoms, should get vaccinated. All right. And whether or not that is, it may be even that you have the flu, you should wait until those symptoms settle down. And you should, if you are COVID positive, if you have been sick and you have been found to be COVID positive, you should wait until your symptoms go away. And you should also wait until your 14-day isolation period is gone, okay, before you can take the vaccine. And so therefore that is I would say that would be the minimum time, if you're sick, wait until your symptoms go away and wait until your 14-day isolation period is gone.
But another thing too, I don't, something that bothers me is that, all right, so normally, all right, on a normal circumstances, persons would just normally take a pill when they're sick and just, just go and just get remedies. So suppose someone doesn't know they have COVID virus and then they might be swayed to do the test before getting vaccinated, because I do believe that sometimes persons don't really have it. So, and sometimes it's better to get the test done the same day and get the results the same time. But I know sometimes that's not possible. So what can government do to, like, what do you call it now? So to make it more available and cheaper, so that more persons can get tested before they get vaccinated. Okay.
The fact is that the persons who have had COVID, it is recommended that they take the vaccine. All right. There has been no harm found that persons are at any increased risk if they have had COVID to get the vaccine. Now, if you are asymptomatic, okay, and you're talking about the asymptomatic person who may not know if they have COVID, whether it is safe for them to take the vaccine, because we know that for the symptomatic person, we want them to get over their illness and to complete their isolation period. But for the asymptomatic person who don't know if they have COVID, then if you do a COVID test, how you would not be able to tell if you have active disease now, or if you have disease now, or if you had it 14 days ago or 2 months ago, because we know that the positive test, it's unpredictable. We've had persons who have been positive 3 months, 4 months after they have had COVID, okay? So what the studies are showing is that whether you've had COVID in the past or not, it doesn't increase your risk of a poor outcome or having serious or mild side effects from having the vaccine. So there's no need to test. There's no need for me to test, because if I'm negative, I'm going to take it. If I'm positive, I'm going to take it, because I can't tell. I'm asymptomatic. I can't tell if it is that I've had the disease now, or if I had it how many days ago or what. So there is no issue of taking the vaccine if it is that even if you were positive in the past and you have a positive test now, you're asymptomatic, then there's been no harm. But if you have symptoms, then you must wait until the symptoms go away. Certainly if somebody goes out and they decide that, okay, for traveling purposes, I'm taking the COVID test. I found out that I'm positive, and I realize that I can get my vaccine now at my health center. Should I go now? I would say to that person, you know that you have a positive test. Maybe you should wait a week or so, just to make sure everything is clear, and then take your vaccine. But if you choose to take the vaccine now, if you're asymptomatic, I'm not going to say that you're going to have a problem, because whether or not you had COVID in the past, you are still recommended to take the vaccine.
All right, I think this is the last question before we wrap up this section of the conversation. So it's, how will Jamaica reach herd immunity if the vaccine does not prevent COVID or Delta variants?
I think that's a debate that is going on right across the world. And I can't tell you that I have an answer for that, or anybody have an answer for that, because look what's happening in Israel. They have over 70% of their population that is vaccinated. And right now, their level of positivity of positive cases is 93% of their peak that they had, I think it was in January. So I can't give you any prediction where that is concerned. But what I can say, though, that it is clear that taking the vaccine has a beneficial effect. And it is clear that several lives have been saved by taking the vaccine. Now, it may be that I am exposed now. I'm in a situation now where my risk of exposure is high. Am I going to wait? Should I wait, therefore, until I have definite answers as to how long the immunity from the vaccine is going to last before I take it? Or do I face a risk now that my contracting the disease could result in a severe illness, even if not to me, but to my friend, my family, my neighbor? Should I take that risk? I would say no. I personally, my entire family has taken the vaccine. I have 4 children, and one is 16 years old. So she was the last to take the vaccine that she took last week. And, our main priority is that my husband is diabetic and hypertensive, and he's at risk. And our main thing is that we need to protect him. Okay, yes, we need to protect ourselves, but we need to protect him, because if he should get COVID, then he's at a severe risk. And the risk is real in my family, because 2 of my children are doctors, and one work in an emergency room, and one just came off the COVID ward at KPH. So our risk is real, but the risk in Jamaica now to everybody is a real risk, and everybody is at risk of exposure. And so there are a lot of things that we don't know, how long the innate natural response immunity lasts, how long will the vaccine immunity last. We do know that the response with the vaccine is much, much stronger than persons who have had just the natural infection. And we have also recently, if you're combing the literature, you would have also seen that They're saying that for persons who have had COVID in the past and then take the vaccine, that their response is even stronger in terms of the strength of their antibody response and the length of it. So right now, this is something that is of benefit to us and to the people around us. So don't wait. The answer that you need to say whether it is safe, that answer is there. You know, we have seen it in the studies, and we have seen it in the what we have been doing over the last couple of months right across the world. There is a risk, yes, for some severe events, but it is so few, as with everything. I mean, if you look at your blood pressure medication, your diabetic medication, your cold and flu medication, there is always that very small risk that is there. And yes, we have to face that. But the benefit far outweighs the risk at this time. And so therefore, I would encourage everybody to take the vaccine.
All right, thank you so much, Dr. Jacquiline McKenzie, for just sharing with us. Thank you so much for your service to our country. We really do appreciate it. And yeah, thank you again. Michael, you have anything to say?
All right, thank you.
Well, thank you. Thank you for sharing with us as student reps so that we also may know more about the COVID situation. Thank you.
Okay, thank you.
All right, and that wraps up our first COVID conversation with our CMO, Dr. Jacquiline Bisasor McKenzie, as well as our student leaders. We have Kai from Edna and Micah from UTech. We'll now be moving into our second COVID-19 conversation, and that's all about how do the COVID-19 vaccines work. Now, we've been seeing all the questions in the chat. I mean, I think a lot of them will be answered during this particular segment because they're orientated to be asking, how do the vaccines work? What are some of the impacts, etc. So leading this section will be Mr. Neil Brevet. He's the president of the United Students Movement at MCU, and Mr. Chavoy Lyons, he's a guild president of the Micah University College. They will both be speaking to Dr. Sandra Jackson Betty. Over to you.
All right, thank you, Ms. Mullings, and welcome to Dr. Jackson Betty. We are so happy that we can, have this conversation with you as we pose some of the questions from our students here at NCU as well as the Micah University. Now, we have received a lot of responses, but we have boiled them down to 4 main points, and we're going to use these 4 points to actually structure our conversation. I'll begin with the first point, and then you can attempt to answer, or we can begin the conversation. And if there are any clarity that we will need, then we can ask as we go along. So the first one is this. Quite a few persons refuse to put faith in the vaccine now due to the contradiction in the information that is being circulated by medical experts. They say that on one hand, you have doctors encouraging persons to take it, but on the other hand, there are doctors warning against the effects of the vaccine on the immune system, saying that it might leave your immune system vulnerable. So what we want you to do for us today, Mrs. Dr. Betty, is to explain to us how the vaccines actually work in correlation to our body's immune system.
Okay, thank you very much. And I'll be happy to try and answer your question. First of all, with regards to the information that is going out there with certain experts or certain colleagues advising the public not to take the vaccine, I would say from my point of view, you have elected a government to lead this country. And I think that they are doing this in the best interest of the people and the nation. We have seen them put aside the majority of many activities and focus and highlight on health. They have been in discussions with international organizations, leading organizations, and they follow the recommendations of World Health Organization, other organizations such as the Centers for Disease Control and Prevention. And we are in this following likewise with the United Nations, with countries worldwide. We are in the middle of the greatest pandemic that we have had since 1918. The government has advised, is requesting, is encouraging all members of the Jamaican society who can to go and take the vaccine. And I think that they're doing this in the best interest of the country, that they have discussed this among their medical experts at within the Ministry of Health. They have sought advice extensively. They've gone to great pains to choose a vaccine and we started with the AstraZeneca. So my advice to everyone with regards to other persons who are saying, don't believe in the vaccine, do not take the vaccine, I would advise these people to follow the recommendations of the Ministry of Health, who have been working on this and who have done more extensive research and investigations, talks, etc., with several partners and international scientists to recommend this vaccine. This is in the best interest of the country. Right now, if you look at the vaccine uptake within the Latin America and the Caribbean, I didn't put that, I didn't anticipate this question coming, but just to let you know that our uptake rate is among the lowest in the entire Latin American and Caribbean country. And we are the largest English-speaking Caribbean country. And we are supposed to be, as Jamaica, leaders within the Caribbean. Therefore, I know everyone has their, may be skeptical. We've been, and I hope that I can answer some of the questions, but in terms of responding to and getting the vaccination coverage up, the last thing that we want is at the end of this pandemic, we go down in history as being the country with a poor immunization uptake, with larger amount of deaths due to COVID. We don't want to go down in history that way. Therefore, everyone, whether you're a young person, students, middle age, elderly, everyone needs to take advantage of the opportunity that science and technology has provided us with at this point, which is these vaccines, right? Which they were not developed yesterday. Many of these vaccines have been in development for years, but having known this and recognized the seriousness of this outbreak, the seriousness of how many families can lose their lives, we're losing the lives of skilled persons that many other organizations have poured funds in to different manufacturers to expedite the process of research, development, and to get these these vaccines that were in development fully out and available to the public globally. So that's a long answer to the very initial part of your first question. Can you repeat the second part for me, please?
Yes, we want you to just clarify how the vaccine, or how the body, the human immune system responds to the vaccine and how the vaccine works in the body.
Okay, let me start by telling you how the body responds to any infection, whether it be coronavirus, whether it be flu, whether it be a strep throat, sore throat, whether you get some other infection, HIV. If you are exposed to an organism that is not normally a part, that's not a part of your normal flora, because we have some organisms that we are constantly exposed to. And so our body has a built-in protective system that allows it to produce what we call antibodies, that these are cells that can protect us against organisms that we are not normally exposed to, or organisms that can enter into us and multiply and cause an infection in one particular organ or another. For example, if you can get an infection in your eye, you could get an infection in your throat. Our body has the ability to produce what we call certain cells that can fight the infections in our throat, or if we have an eye infection, can fight the infections in our eye to help us to clear this infection up naturally without taking any outside antibiotics. The same antibodies that are produced. Okay, now for each different organism that you are exposed to, your body produces a different set of antibodies to protect you against that organism. So similarly, with wild type coronavirus, wild type meaning the one that is out in circulation in the community, if you are when you are exposed to that, it naturally stimulates the body to defend itself and to produce antibodies to the coronavirus. But what we find is that there are some viruses and there are some bacteria that are have the ability to cause more severe infections when you initially get exposed to them than others. Some, for instance, you may get exposed to a particular, there are different types of coronaviruses, or there are different types of respiratory viruses. You may get exposed to a particular virus that's not a coronavirus. Your body will produce antibodies to it. You will get a little cold and you recover yourself. Okay, your body heals itself. But some of these coronaviruses, like this mutated SARS coronavirus, it doesn't cause a mild infection. It can cause not just a mild, it can cause a severe infection, severe enough to kill you. And unfortunately, there are certain viruses, not just the coronavirus, like you heard about, like Ebola. Ebola is another one that if you get it, it's a severe infection that you get. So similarly, that our bodies can produce these antibodies to the coronavirus naturally, but more or so the coronavirus has such strength that when we are exposed to it, what we call virulence, it's highly pathogenic. Therefore, when we are exposed to it, the chances are 20% of persons may get a severe infection. And whereas you see, and where others may recover. But that 20%, when you look at large numbers, we don't know which 20% that will be. You have high risk that fall into that, but apart from the high risk, you can't just focus on that 20%. With the vaccine, what the vaccine does is take a part of the virus, okay, and expose your body to a particular part of the virus. And when there are different types of vaccines, but I'm referring now to the AstraZeneca or the Moderna, you're being exposed to just a part of that. When your body is exposed to that part, and the part that you're being exposed to in the vaccine is the part that will stimulate the best protective response from your body. So the antibodies then will be produced against this particular component of the coronavirus. So when the coronavirus enters into your body, the antibodies will protect you. The antibodies will neutralize the coronavirus before they have a chance to attach to your cell. So the coronavirus won't be able to go into your cell. The antibodies are going to block it, so it won't be able to go into your cell. So this is how the vaccines basically is working. It's stimulating your body to produce these protective cells called antibodies, okay, that are going to block the coronavirus when you go out, when you're exposed to someone, block the coronavirus from entering into your host cell. And that's the most important form of protection now. So we have two forms. You have the form where social distance, where you're reducing your exposure to the number of coronavirus particles. If someone sneezes or someone coughs or someone even talks or sings loud, they can emit, if they have the coronavirus in their upper respiratory tract, they can be spreading these virus particles out as they speak. So the mask wearing is important because the mask wearing is going to try and block these particles from going to the other person, right? So when you even wear your mask below your nose, on your chin, on your forehead, it's not helping, because this is where we breathe. Through our nose, this is where we talk, through our mouths. And they've shown that even this is why in choirs, people that sing, okay, or talk loud, in choirs that singing, etc. If you infected persons in choirs have in fact infected whole choirs, right? There are 3 or 4 instances in the States where they had a choir practice and one person standing in the back row of the choir was infected, and everybody else, 98% of the choir got infected from that one person. So this is why the mask, the social distancing, this is important. Okay, so I don't know, I hope that explained how the vaccine works in simple terms.
That definitely answers the question. I'm gonna turn over now to Shafai with his point.
Thanks for that, Mr. Brevet. Mrs. Jackson Betty, you would have lamented that we should take the vaccine because it helps to stimulate the body and builds protection. While on the other hand, as Mr. Brevet would say that some medical practitioners are telling the public that they are supposed to be wary of taking the vaccine. So the question is, and this in particular with persons with underlying illnesses, should persons with such illnesses be cautious of taking the vaccine? Why or why not?
Persons with underlying illnesses are encouraged to take the vaccine. And the reason for this, well, if they have questions about it, what they should do, if they go to one medical doctor who is telling them don't take it, I would tell them to try and get an opinion from another doctor as well. And I would also ask them to consider the advice from the Ministry of Health that the Ministry of Health is giving. The Ministry of Health also has an outreach line where persons who have questions can also call and get more information. So I would advise persons to seek more information before they actually make a decision about not getting it. Now, the reason why I'm encouraging persons who have underlying illnesses to get the vaccine is because, as I said, this virus is not like other coronaviruses. This virus is a very strong virus. Its ability to cause severe infection is greater than the other coronaviruses out there. People who already have underlying illnesses are more susceptible, therefore, have a greater chance or are at increased risk of being among that 20% that can get a severe or critical infection and die. Therefore, such persons are encouraged to take the vaccine. What the vaccine will do is allow the body to stimulate the production of these protective cells, and therefore, should they be exposed to the virus, they have a better chance of not getting a severe illness or ending up in hospital. If you allow me, Mr. Lyons, I actually have a slide that will just help to show the difference between the vaccinated and the unvaccinated. And if you'd allow me to just show it on the screen, it would take, it's up to you if you would like the audience to see it.
Ms. Mullings?
Sure, I'll just give you sharing screen privileges. Or maybe Mrs. Collins
Okay.
break.
Yes, I have it
Okay,
there
great.
now. Thank you. Right, so I'm sharing my screen. I hope you can see it here. This is just showing you some recent data that was posted. This is from the UK, showing you the rate of hospitalization among vaccinated and unvaccinated persons, okay? So you see the red line here is showing you, and this is recent, this is up to the 20, I don't have the bottom because I have you on the bottom here, but this is current information. The unvaccinated are the greatest admissions, followed by persons who have only had one shot, and then persons who have been completely vaccinated presently have the least rate of admission and severe infections and deaths in hospitals. So this is evidence to show that the vaccine is working in protecting persons and stopping admission, severe and critical infections. I'll stop sharing.
Okay, thank you for that. In response to that chart, as well as the previous questions you've answered, what we see is that the vaccine, does not provide 100% immunity. And some may say that it doesn't prevent a person from spreading the virus either, or preventing them from catching it. Also, persons say because of the the speed or the quickness in the creation of the vaccine and how they actually made the vaccine, it is a bit suspicious. So they would rather to depend on the natural immunity of the natural immune system, the response to the virus, instead of actually taking the vaccine, which, in essence would do the same thing. So could you provide some information on that? Does the vaccine and the immune system, natural immune response work the same way? If not, why?
Yes, okay, let me answer the last question first. The vaccine and the natural response, if you get exposed to the natural virus, you have a greater chance of getting a severe infection and dying because you're being exposed to the whole virus. If you take the vaccine is only using a small component of the virus, not the whole virus. So the virus is not able to replicate or multiply within you. Therefore, you will get an antibody response, but decrease your risk. Your chances of dying or getting a severe infection if you take the vaccine is much less. Okay, even if you take it and you do get an infection, because what the vaccine is doing is providing you with the army to fight this infection so you don't get the severe infection. So it doesn't say you can't get exposed to it because the virus is still circulating in the environment. But what it will do is, in addition, reduce the number of virus particles that you transmit and shorten the period that the virus would actually be multiplying within you if you have the vaccine. So the vaccine does make a difference. That's the second part of your question. Can you repeat the first part, please?
All right, some believe that the natural response, the natural immunity or the response of your body's immune system is basically as effective as the vaccine. So why not, just build the immune system to fight against it instead of taking the vaccine, which will do the same.
Right. But this is what I just responded to. If naturally you get infected, you have a chance of the whole body becoming actually infected with the virus. Let me share my screen again. Are you seeing my screen?
Not yet.
Not yet, okay. Share screen. Okay. Okay, can you see this? No. Okay, so this is.
We're seeing the flyer. We're seeing the flyer.
Oh, you're seeing me still?
Seeing the flyer.
Way to know the flyer.
Okay, let me see. Stop share. Okay, so can you see the virus here?
Yes, we're seeing it.
Okay, so this is a virus. If you say, let me get this infection naturally via natural immunity, what's going to happen is that the whole virus is going to come inside of you and multiply. You're going to be exposed to all the components of the virus. If you get, what the vaccine does is take one part of the virus, this part here, the spike protein, this red part, which is the part that attaches to the receptors in your lung, right? And initiates the infection. But the problem with the coronavirus is that we also have these receptors in other organs, which is why the infection can be more severe than the flu at this point and some other, because we have these receptors, they call ACE2 receptors, in the lung, also in the heart, in the gastrointestinal tract, right, in your gut, right? They're finding receptors in other organs, in the kidneys. So it's possible that you can get the virus replicating in other organs as well in the severe cases, not just in the lung. Now, when we give the vaccine, you're only getting a part of the virus. that this part, the spike protein, is what's included in the vaccine. So you're getting antibodies being produced to this part. So and your body will produce antibodies to the spike protein. Therefore, if you are exposed to the virus after you get the vaccine, the virus will come, it will try to multiply, but it won't be able to attach. It won't be able to attach because you will have antibodies that will block the attachment of the spike protein to your cells. Therefore, your chances of this whole virus replicating in your lungs or in other parts of your body, or you spreading it to a loved one in your family, your mother or your father, okay, is your chances are less, because you are going to get rid of this virus much quicker than you would if you did not have it. So it's much better to get your immunity, but by the vaccine rather than getting it naturally, because naturally we don't know what effect and what is going to happen to you. We can't predict what the outcome will be. I don't know if I hope that clarifies that a little bit more.
Most definitely. Thank you very much for your time. Time has run out on this section, and so we really appreciate the information you shared. And now we're just going to turn over to Danielle Mullings for the next section of the program. I guess we'll see each other again at the question and answer period.
Yes, we will. Thank you so much for moderating that session, and thank you for the information you've shared, Dr. Jackson Betty. That's useful. Now, I know there are many questions coming in the chat, and what we're going to do is just put them at the end after this last COVID conversation. Allow those to be answered directly, just solely looking at those questions. That being said, we're going into our third COVID conversation, and that would be moderated by myself, in addition to Mr. Ramon Smith. He's president of Shortwood Teachers College, and we'll be speaking with Dr. Sandra, who about her experience as a nurse on the front line and why she chose to be the first to get vaccinated. So that being said, I'm going to go into the first question, which is, what was that experience like? You would have been working on the front line when COVID-19 and the patients are coming in, and that may have been maybe even scary as a healthcare worker. But what was that experience like, seeing it exploding at first?
So Danielle and everyone else on the call, good morning, and thank you very much for inviting me to share my experience with you today. To Dr. Jackson and Dr. Bisasor McKenzie, it's a pleasure to share this platform with you as well, and thank you for your content. I continue to learn so much every day as I listen to the experts. So to answer your question, Danielle, it's something that I never, ever in my lifetime want to go through again. 3 weeks after identifying patients in New York City, 3 weeks after that, we became the epicenter.
1 second. There's one person that's unmuted. Could you please just mute in the chat, please, so we can properly hear Dr. Lindsay? All right, go ahead, Doctor.
We became the epicenter. My hospital, Long Island Jewish Medical Center, which is one of the hospitals in the Northwell Health System, sits right on the border of Queens and Long Island. So Queens got hit heavily. You may have seen in the news. And so we got a lot of those admissions. So we were within the epicenter of New York. Our hospital capacity typically is 584. That's what we're registered for. We went up to almost 1,000 patients during the peak of the pandemic. We have an adjoining children's hospital, and thankfully at that time, the children were not affected, and so we were able to surge into that area. Now I serve as the critical care director at Long Island Jewish Medical Center. Our normal capacity for critically ill patients for the 4 ICUs that I run is 48. We went up to over 160 patients daily. So every space in this building that could hold a monitor and take care of a critically ill patient safely. We used every single space, including building out what looks like a warehouse of an ICU within 2 weeks that housed 54 patients. So when you walk into that area, consider walking to what looks like a warehouse and seeing patients of all ages on ventilators, gasping for air, fighting for their lives. It's something you never want to experience. Never, ever did I think that I would live through something like this and would never want to live through anything like this again. We are still suffering mentally and physically from those devastating images, the workload, the burnout, and just moral distress as healthcare workers, not being able to save every single patient, which is what we pride ourselves on doing.
All right, thank you so much. Thank you so much, Dr. Lindsay. But as you just explained how vicious and how much this virus has affected not only yourself, but New York City on a whole, I just want to know, how was that for you, being like the first person to get the vaccine? How was that experience for you? I think it would be nerve-wracking for me. So how was it for you?
So thank you for that question. So having gone through this experience, it didn't matter what time I went home. I worked long hours, 12, 14, 16, and even when I was home, I was still working, trying to figure out where is the next patient going to go, how are we going to staff it to make sure people get the best care and have the best chance of survival. So I would turn on the news and I read from credible sources, and I want to underscore that word, credible sources, about, what are we going to do about this? I knew that, the wearing of our masks, which is incredibly important, as Dr. Jackson pointed out, social distancing, meticulous hand hygiene, which we should be practicing anyway, those are going to help us to decrease the spread, but it won't help us to come out of this devastating crisis. Only something like a vaccine can help us out of this. So I have been hoping and praying and reading and following the development of the scientists of getting to where we are today. I also know that this vaccine, the technology is not new. It's a culmination of decades worth of work from credible scientists that has led to the development of vaccines and so many. And I think, I am grateful that the vaccine was developed in record time. Otherwise, more lives would have been lost and more livelihoods. So I am grateful that the scientists came through for us in record time, and the technology is not new. So when I got that call on December 13th that, the vaccine is coming to New York, it's coming to Northwell Health, everybody in this building knows that I've been an advocate for vaccine ever since I heard of development, because I know that's what it would take to get us out of this predicament. So when I got the call that the vaccine is coming, are you still interested? No hesitancy. I said, absolutely yes. Where should I show up? I showed up an hour earlier, not knowing that I would be the first of anything. All I wanted was a shot of life. In every one of my patients that I saw in the ICU, I took the time that died. I took the time to know them. Who is this patient that was in Bay 6 or 7 or 50? What were they like? What did they do? What about their family who couldn't be there? So I saw myself in any one of them, and I just wanted a shot of life. And that's what I got on December 14th. And I say to you now, thank you, you young leaders, you're the future. And you have a wealth of information to now go share with your colleagues that you are not immune from getting this virus. Similar to what Dr. Bisasor McKenzie reported about how the virus, the age group that the virus is affecting, this is what I'm seeing right now in my hospital. That age group in the 30 to 39 and 20 to 29, and it's heartbreaking.
So thank you so much there for answering those questions. We have one more question for you, and then we'll go to the Q&A section. And that is, as a healthcare worker yourself, what do you wish people knew about the virus, about the vaccine, and what do you wish people knew that they don't right now or seem not to?
I wish people to know that this coronavirus is real. I encourage everyone that we should all be going into this well-informed when we make decisions in anything that we do, but read from credible sources. This is not the first time, especially as Jamaicans, I know I have my scars to show that we are used to being vaccinated. The difference is we didn't have social media then, and so many people who are spreading propaganda. And so we've had successful vaccination programs in the past. That's why we don't have more polio. That's why we don't have more smallpox. That's why more children are able to survive, because we're able to vaccinate against childhood illnesses. So I want people to know that this is real. This is nothing to play with. As I said, we are still suffering the consequences. What are the chances that all world leaders could come together with the same message and be telling us the same things? There are many things that world leaders don't agree on, but one thing they agree on is that COVID-19 is real. It's killing our population. A country without people is not a country. And so I'm going to appeal to you, which I know you can, you young leaders, to go out, spread the word, help your leaders to lead your country out of this crisis. I heard, there are many different strategies to get people vaccinated. One of them, which is going out mobile, on foot, drive the bus, volunteer to drive the bus. If you're not driving the bus, direct the bus where to go, get your communities out to line up and get vaccinated. Lead your communities and your country out of this crisis.
Thank you so much for sharing with us, Dr. Lindsay. I think that was very heartfelt, a lot from your experience. So that being said, there have been so many questions coming in on the chat from our live audience watching. We're almost at 200 viewers. And I'd like for our student leaders to just pick one of the questions. We do have them here and put forward. And either Dr. Jackson or Dr. Lindsay can respond. And I think we can start off with someone asked, if vaccinated, are we less likely to transmit the disease? And will this then assist if more of our population is vaccinated?
Yes, Danielle. Yes, if vaccinated, more of our people will be protected and you'll be less likely to spread the disease because you will have less of a viral load or concentration of virus.
All right, thank you so much for that answer. Ramon, would you like to ask the next question? Any of them from the chat?
All right, so I see a question here that says, how is the mRNA vaccine better than the natural immunity if all it does is use your cells to produce a spike protein that antibodies bind and the same spike protein directly from the virus? And I think the best person to answer that would be the Dr. Sandra Betty.
Hi, thank you. Yes, the difference is that what happens is that the virus has to use a spike protein to attach to the cells to start multiplying. So this, and your body makes antibodies to this spike protein. This is the most important part of the virus. So the vaccine, the mRNA vaccines, is actually stimulating the body to make antibodies to this spike protein. So this is how the mRNA vaccine becomes effective without you having, as I showed you in that diagram before, without you being exposed to the whole virus and all the components, because just introducing the spike protein alone, you're not able to have the virus, can't replicate because the whole virus is not there, but yet still you're getting the best of both worlds. You're getting being exposed to the antigen, and at the same time, you're getting, your body is producing the most important antibody, and that is the antibody to the spike protein.
Thank you, Miss.
All right, so someone says the way the government wants us to take the vaccine is really weird. Why force people to take it? Why bribe people to take it? Why vaccinated persons still have to wear masks?
I think CMO would have been answer that, but I don't know if Dr. Lindsay would like to try. I see she unmuted.
Yeah, I think Dr. Jackson alluded to this when she started her presentation about the importance of government in protecting public safety and the responsibility of the population to help your country and to protect those around you. So being that we are in the middle of a crisis and everyone recognizes not just Jamaica, around the world, the importance of preserving lives. They're offering whatever it takes to help people first to understand, give them the education. But if any incentive, encourages the population to do the uptake, then they are willing to do that as well to preserve lives. So it's not just Jamaica incentivizing. Here in the US, where I work, we've been, names have gone into raffles. You probably heard about different states giving raffling cars, et cetera, because it's so much of an emergency, and whatever it takes to help people, to incentivize people to get vaccinated so we can preserve more lives. I think Dr. Jackson also did an excellent presentation on why it's still important for vaccinated people to wear masks. So Dr. Jackson, if you want to just take that second section again, I think you did a great job with that.
Okay, thank you. Yes, as I said, when you're vaccinated, you still have the chance, and it's still possible for you to be exposed to the virus, and the virus will try to multiply within you. However, it will not be able to attach to all the cells because the receptors will be blocked by your your antibodies. But you will have a transient, what they call a transient infection. During that time when you're exposed, it will be possible for you to, in some persons, it may be possible for them to actually transmit the infection to another person while your body is actually fighting that infection. Therefore, you need to wear the mask. The other thing is that because you still have this small chance of becoming infected when you go out, we're still wearing, prevention is better than cure. Just because you have the vaccine doesn't mean that you yourself still, there's a very small percent of persons who can still get more symptomatic infection, particularly those who are at high risk. And what we found, and with the variants that are emerging, there are some of the vaccine is protective and does offer protection still. However, there may be some breakthrough infections, and you may get an infection, but you won't get it as severe as you would if you were not vaccinated. in such cases, you still need to wear the mask because you want to prevent those particles prevent exposure to as many particles. A third reason is that it has been shown that the greater the exposure, the concentration or the virus load that you're exposed to is the possibility of you having a more symptomatic infection versus if you are exposed to a smaller virus load or concentration. Over.
Thank you for that response. Yeah, go right ahead.
Right. Some business places are recommending that unvaccinated persons be tested every 2 weeks. So the question is, should you be fully vaccinated? Would there be a need to get tested thereafter? The question is directed to Dr. Betty.
I think Dr. Bisasor would be better able with regards to the policies being implemented from the Ministry of Health with the workplace safety protocols. As far as because this as this is in discussion, so Dr. Bisasor, would you like to take this?
I believe she may have gone to another engagement, so no problem there. You can probably, yeah. If you have any you'd like to note.
Yeah, if she's there, yes, well, I'll contribute. In terms of workplace safety protocols, as we said, and as we've been discussing, being vaccinated does not prevent you from transiently being exposed to the virus and also possibly transmitting it to someone else. When you're in the workplace, I'm going to share one slide with you. What you're actually doing is we're getting different households sharing the same workspace. And this is how we're going to end up with having, where is it? Oh, I have this. Social, can you see these social bubbles here?
Yes, we're seeing.
Right. So within the workplace, so if this is your home, okay, even if all of you are vaccinated, if this is another person's home and this is the workplace, you don't know what % of the persons at this home have COVID, are asymptomatic or have been vaccinated. Although coming to the workplace, depending on different places have different workplace policies. Some will say that it is mandatory. Some may say that it's not, it's a personal option and therefore you can't force someone to take a vaccine, but you're going to have a mixture of of people within the workplace. Therefore, what is showing now and the evidence that is coming up now as people go back to work is with the mixing of the vaccinated and the unvaccinated persons in the same place. These people are carrying it. You may not have it, go to work, you get it because somebody else within another household had it, and you go home and then you are going to infect your household, okay? And then from there, it's just going to continue and continue. So using the mask as a way to interrupt the transmission is something that the CDC and other international organizations are still enforcing at this point. So it will help to interrupt transmission. I don't know if Dr. Lindsay wants to add to this.
Yes, absolutely. Here at Northwell, so I don't know if you've heard, but New York State has now mandated vaccines for all healthcare workers. So we have a deadline for September 27th for people, healthcare workers, to be vaccinated. We continue to support. At Northwell, we have almost an 80% vaccination rate. We do know that with some clinical conditions may preclude people from getting vaccinated. And beyond that, we continue to provide education and support people in order to make that informed decision voluntarily. We have restructured our break rooms, etc. Now that the weather is nice, we have a big campus, so we encourage people to go out, especially when they're having lunch, when they have to take off their masks, so they're not, we don't have that mixing and spreading and, you know, interrupting your personal bubble. So especially, you know, in Jamaica, we have beautiful weather most of the time. If you have to take off your mask to have lunch, or you just need a breather, make sure you have that physical distance. Use the outdoor as well. Try to limit your bubble so that you're not spreading and mixing. We will have more time for all of that when we get this under control. But keeping within your bubble and preventing that spread through mask wearing and physical distance is going to be very, very, very important.
All right, thank you so much for that. So Neil Brivett, do you have any questions you'd like to put forward?
Most definitely. The first one, how will this vaccine actually combat the variants? Because there are different types of the COVID-19 variants. So how will it actually combat the variants, or will we need a vaccination according to the different variants?
Okay, thank you for that. Yes, what happens is that the spike protein that I showed you in that diagram, the antibodies to the spike protein, there are different components actually of the spike protein. And when we break it down and we look at the actual genetic composition of it, the variants may be just a change of 2 or 3 of the base pairs, etc., or a combination of them. The antibodies still will produce some protectivity. The level of protection varies depending on the variant that we're speaking and referring to. But so far, it has been shown that the vaccine is providing a good enough level of protection, even to the Delta variant that is circulating, and also to the UK variant, which was the predominant variant before the Delta variant was introduced. So, and in addition to that, the World Health Organization, they have formed a group that actually are looking at the variants, and just as with the influenza vaccine, where they monitor the circulation and of the different influenza types and subtypes on a weekly basis and communicate in a global network. This is also happening, and the Ministry of Health also is doing surveillance among the different parishes, looking to see, okay, what we do, what is it that we have, what is circulating, and communicating with the required international bodies on the circulation. So in terms of knowing, is the vaccine effective or not? Yes, we are keeping in touch, or they are keeping in touch to see. So as I said, although different vaccines will have different levels of protection, so far the ones that we are offering, that the ministry chose, particularly AstraZeneca, is giving a good level of protection. In terms of will we need another one, this is a question that they're looking at. So far, it looks as if we may need another, but this is from reports that have been published and from discussions, because the immunity seems to wane after a time. So just as you can have booster shots with the other vaccines, you may need to have booster shots with the coronavirus vaccine. So this is something, they don't have the complete answer as to the timeline for that as yet.
All right, thank you so much for that answer. I see that the CMO is back. So I do have to throw a question to her since she's back. That one would be, someone asked, what if we abandon mask wearing, don't get the vaccines, and just act as normal? What would happen?
Okay, hi again. Sorry, I had to skip off for another meeting, but I'm happy to rejoin. Well, you know, as I explained earlier, what would be the cost? What would be the cost? The fact is that the cost of lives, it would be tremendous. because if we just allow, if we do that, what we would do is we'd be allowing the virus to run rampant throughout the country, and we'd have a lot more persons exposed, infected. And yes, eventually you may reach to a point of herd immunity, but the cost of it would be several deaths. We would really run into a situation that our health system would be severely compromised, not just in terms of the management of COVID, but we would also be impinging on the management of other illnesses, because our emergency departments would be inundated. Our ability to provide surgeries, not just elective surgeries, but emergency surgeries if we're out of oxygen, all of those things would be impacted. So it would be at a tremendous cost. And we have to recognize our capacity within country. Over time, we have really tried to keep the numbers below our capacity to manage, as we had worked on continuously increasing that level at which we could manage. But it would be a tremendous cost to lives and to the entire hospital health system, and not just the lives for persons from COVID, but the lives for other persons as well.
Yeah, thank you so much for that answer.
Danielle.
Oh, sure, go
Danielle,
ahead.
if I may just expand on that, and Dr. Bisasor McKenzie, that's a very important point to make, that yes, we're thinking about COVID, but what about those in our population where you have a chronic illness, or you may have an accident and you cannot get into a hospital bed because our hospitals are overrun by COVID patients? What we're also seeing now in our ICUs are the patients that are coming in, even without COVID, are much sicker because they have delayed care. They were afraid coming in because they didn't want to get COVID, or they couldn't get in at that time. And so care has been delayed, and they're much sicker now, coming into our hospitals, requiring more resources. So even though our COVID numbers have decreased significantly from where we were in the peak, we're using more resources on those who delayed care, couldn't get in because we were overrun by COVID.
Right, and that reality is very stark, very stark to us here in Jamaica already. I mean, we saw the situation where we had 100 persons waiting on beds in the Savlamar Public Hospital emergency department. 30 of those persons were COVID related, and 70 of those persons were other illnesses. So it is a reality that if you meet in a motor vehicle accident and you go into an emergency department right now, the beds are full. The beds are full. The cost is phenomenal. Not just in terms of secondary care services as well, but also primary care services, in terms of being able to deliver the care that is required for COVID, and that will only keep ballooning if we increase exposure.
Thank you so much for these responses. I'm going to have the final question come from Ron. He's the president at Shortwoods Teachers College. Go ahead.
Thank you so much, Danielle. This question is from a viewer, and she said that if you have taken the vaccine 2 weeks ago, so the first dose 2 weeks ago, and you feel effects such as abdominal pains or fever or pain in the arm, because she's fearful, should she take the second dose? That can go to either Dr. Betty or any of our panelists.
Well, let me give a first response to that. Yes, it is that we do expect that some persons are going to have responses to the vaccine, inflammatory responses locally, first at the site, and some of them may even have some systemic responses. We do expect, and what we have seen is that these settle over time. Certainly, yes, you must get the second dose.
All right, thank you. Does anyone who wanted to add to that point? I thought I saw Dr. Lindsay may have unmuted a while ago, I'm not sure. No? Okay, great, no problem. All right, so that would wrap our session. We've had so many important pieces of information that have been brought across. We want to thank each of our experts for spending the time, taking the time out to speak directly to the tertiary student body. On behalf of all the presidents here, I greatly appreciate it. And we'd also like to put forward, if you need volunteers from the tertiary student body to help Jamaica in the fight, please let us know. We'd be happy to engage and also engage our student bodies. That being said, I'm going to throw to Dr. Camilla Hilton. She's the Dean of Faculty of Science and Sport at the University of Technology, and she will give the final closing remarks before we end today's session.
Thank you very much, Danielle. I must begin by saying it was really refreshing to sit back and have our student leaders take the lead. Universities are indeed charged with preparing leaders, and I can see that we are in fact fulfilling that mandate. So I'm very pleased, and I must say thank you. It's also so heartening to see all of the tertiary institutions working together. And when we contemplate COVID-19 and the response that is necessary, one that is in fact collaborative, these kinds of approaches are truly heartwarming, and I really want to thank the student leaders. I must certainly thank our CMO, Dr. Bisasor McKenzie, Dr. Jackie, Dr. Sandra Jackson-Betty, and Dr. Sandra Lindsay. I really want to thank you for engaging us in these conversations. I thank you for taking the time out. These are the kinds of conversations that allow us to hear the facts, allow us to evaluate, and then allow us to make decisions based on facts. So really want to thank our experts for sharing their time with us. I want to thank the students who would have come online and would have, of course, given their points of view, asked their questions. I hope that their questions, their concerns would have been clarified coming out of this kind of conversation. I also would want to take the opportunity to encourage those of us who have these kinds of questions to continue asking the questions, because certainly in our being able to understand each other, are we able to then come up with strategies that can work? Because we recognize that COVID is not going anywhere. There's certainly the recognition that no one is immune. Dr. Lindsay would have shared her experience on the ground, and we recognize that our actions affects the next person. No man is an island. And so we have to, of course, work together if we're going to surmount the problems that we are currently experiencing. So I'm going to close out this session by, of course, indicating that we are hoping that this is the first in a series of conversations. We're looking forward to the institutions continuing to work together. I'm happy to hear Danielle indicating that they're willing to volunteer, and I'm certain that the CMO will be taking them up on that. And I want to therefore encourage us all to look at the credible information and make educated decisions. Thank you all for being here. Thank you for joining us, and look forward to many more. Enjoy the rest of your weekend and the Friday.
Thank you so much. And this has been The Way to Normalcy, a COVID conversation with tertiary students all over Jamaica. As Dr. Hilton said, please enjoy the rest of your weekend. Stay safe, stay dry, and get vaccinated.